Dr. McDougall,
Yes.
Commissioner Alam, Dr. Jackson,
Yes.
Dr. Braithwaite,
Yes.
Dr. Miller, Mr. Brown,
Yes.
and Mr. Gregorio.
Yes.
Thank you.
Very good. Very good. So hopefully, again, everyone has had an opportunity to review the minutes from our August meeting. So with that said, I will entertain a motion to accept the minutes if there are no additions or corrections there.
So moved.
Second.
All right, it's been moved and properly seconded. We're ready for the vote.
Dr. McDougall,
Yes.
Commissioner Alam, Dr. Jackson,
Yes.
Dr. Braithwaite,
Yes.
Dr. Miller, Mr. Brown,
Yes.
and Mr. Gregorio.
Yes.
Thank you.
All right. I don't think we have any, but I'm going to ask Rosalind again. Do we have any public comments that have been registered?
No, sir.
Okay, very good. So we're going to move on to staff and program recognitions. Director Jenkins, we'll let you have the floor at this time.
Thank you, Mr. Chair, and good evening to this illustrious board. It is a great privilege for me to officially introduce you to our new Director of Nursing, Ms. Malkia Kiki Rayner. She is the Director of Nursing and the Director of the Medical Services Division. Her official start date was September 4th, 2023, but she also provided expert service to our agency as the interim Director of Nursing immediately following the retirement of Ms. Hattie Wood. Big shoes to fill, and she knows it. The good thing about it is Hattie had been working with her and schooling her on the ways of Durham Public Health. Kiki has worked effectively within our department for roughly 3.5 years. Prior to her time in Durham, she worked in a number of supervisory capacities, particularly in smaller to medium-sized local health departments. You think about different areas of public health, from STD to communicable disease, TB, family planning, breast and cervical cancer control, wise women, teen wellness, pregnancy test counseling, WIC, school health, which you will hear about a little bit later, and diabetes education. Ms. Rayner has simply done all of the above. So it's that panoramic view and that experience that made me think that she would be the excellent choice to lead our nursing corps. One thing I do know about her, she's a fighter. She is grounded spiritually. She's a grown woman and she can speak for herself. So with that being said, I love to reintroduce to some and introduce to a few, Kiki Rayner.
Thank you so much, everyone. Can y'all hear me?
Yes.
All right. I just want to say thank you so much for allowing me to serve for Durham County. I'm excited to fill the big shoes. I'm excited just to be here and just to keep us moving forward in our nursing corps. So again, you will hear more to come. So again, I'm a woman of words. And a few words I can say, but more of my actions. So I'm looking forward to working with you and looking forward to working with Durham County Department of Public Health. Thank you.
Thank you. And I will reiterate the welcome that Director Jenkins shared. We certainly welcome you to your new position and to this board meeting. All right, so we'll continue on with the agenda. We have our presentations coming up next, the first of which is our school health program that will be given by our school health team. I'm not sure who exactly is going to lead that presentation.
So while they are setting up, I am excited.
Right.
They are popping up. I see them popping up on the camera. I'm excited that you are asking for updates, and two, I'm excited just to, these are not all over the school health, but these are few. So I just wanted to introduce to Miss, and I know Sarah and Liz are in the room together. So we have Sarah Snyder, we have Cheryl Parsons, she's here. We also have Miss Lee Antoinette, but she is unable to join us today. But I'm also excited to introduce Liz Stevens. She is part of our supervisor team. One of the things that you will hear us talking about, and you can move to the next slide for me. And I don't know if they are able to move to the next. There we go. One of the things that I just wanted to make sure that when you're hearing the topics today, what we are excited that you're going to hear is just moving our team forward. It has been very exciting to be a part of School Health. School Health has been very dear to me. But I wanted to make sure that even with our team of what we have, one of the tasks that I have assigned the supervisors is we are going to move past the past, and what was, and what is to come is just so much more. And so one of the exciting things that we have been working on is that we are going to go over today. Some of the topics that we're going to go over is staffing structure, funding, recruitment of nurses, partnership with DPS nursing team, goals and challenges for the year. So we're not sugarcoating, but I'm excited of just to see the team. I wanted to bring the team because, again, they are the ones that are working and servicing the schools or in the community, and I cannot do it by myself. So again, I always bring the team along because, again, the team is what helps us carry and moving us forward. So I know Miss Sarah is going to present. So I'm going to turn it to Miss Liz and Sarah. Thank you so much.
Thank you, Kiki. So I'm here with Sarah Snyder, who, like Kiki mentioned, is one of our school health nurse supervisors. We're also joined by Miss Cheryl Parsons, and our third supervisor, Miss Lee Antoinette, was not able to make it tonight, but was involved in getting this presentation together for you. So I'll let Sarah take it away.
Okay, thank you, everyone. It's a pleasure to be here with all of you tonight. I've been with the county for a while, first as a school nurse and now as a supervisor. So I feel really grateful to be here talking about the program that I love. You can see the agenda here. First, I want to talk a little bit about our staffing structure. So you can see here, we have a public health nurse program manager, which is a currently vacant position. We have 4 public health nurse supervisor positions, of which 1 is vacant right now. And we hope to be hiring for that in the near future. We have 32 total senior public health school nurse positions, of which right now we have 13 filled and 19 vacant, with interviews ongoing, which we'll speak a little bit more about further into the presentation. We're really excited about the direction we're moving with those vacancies. And we have 1 processing assistant who helps us with all of the day-to-day and large review items. Right now, we have plans for at least 8 contractor nurses. So those would be registered nurses and LPNs, and that funding will be provided by the agreement addenda 620 here. We are excited about contractors. Contractor utilization this past year was very successful at improving workload distribution in our program and increasing school staff satisfaction, which is really where we want to show up for our staff and our students that we serve. Funding here, you can see this is a snapshot of the funding for our program for this current fiscal year. If you have questions, I would defer to both Kiki Rayner and Liz Stevens. They're happy to answer questions for you. For recruitment of nurses, this is an ongoing process that we are very hopeful about right now. Just this week, we were able to attend a job fair in NC Central, which was at the nursing school, I should point out as well. As far as recruitment to these positions, our Human Resources offers a sign-on bonus of $6,000, and we offer a referral bonus of $1,000 for our current staff to recruit friends and colleagues that they know, and that has been successful to a point. We've made outreach to area schools of nursing, and that includes hosting nursing students from many of our area universities, some starting just next week with us, actually. We've had 2 new nurses start with our program just this month, 1 starting Monday. We're very excited about our new nurses. We've had a lot of qualified applicants with several interviews scheduled and others pending. And we've successfully hired several previous contracted nurses with us. So these nurses we were able to work with in the schools. They were able to get a good preview of what school nursing is and then join us. partnership with the DPS nurse team. So as you may know, we are part of school health in Durham County. The Durham Public Schools also has a school health team. And so we collaborate as much as we possibly can. And some of the ways that we do that are meetings and trainings together, being involved at kickoffs, which aim to sort of start our school year off right. And we have a new partnership and collaboration with the DPS planning team. So DPS planning, nutrition and transportation specifically are newer departments, and they really look at the global view of where they want these areas to go within Durham Public Schools. So we are excited to have them come and talk with us, and we have future plans to collaborate on several projects, namely resources for students with diabetes, and then involving nurses in more events such as walk or bike to school day. Having your nurse visible in that setting is a great goal for us. We have ongoing participation in the School Health Advisory Committee. This past school year, we had 3 school health staff, that consistently attended these meetings. And this really, we saw how much this supported creating relationships with various staff within DPS, whether they were in DPS planning, DPS leadership, or school staff. And we have true collaboration to cover school health needs and assignments. So this year we have been really successful so far and hope this to be ongoing, having a closer partnership with the Durham Public Schools lead nurse, Tricia Howard. And we're really working to improve the way we communicate on both sides to have really unified front. And I wanted to share an example of this. This happened with me and one of my nurses that I supervise. Recently, we had a student with complex needs that had a large multidisciplinary team involved in her care. Some determinations were being made for this student about the needs and how we were going to meet those in the school. And the lead DPS nurse, Tricia, was consulted at some point in the process for her point of view. And we were really happy to see that due to our consistent collaborative discussions, she was previously aware of the student and their needs and supported our input and plan. And just to note, the Durham Public School nurses staff 13 total schools, and our health department nurses here in our school health program staff 43 schools. Collaborations are a big part of what we do because we do not operate in a silo. We can't to serve our students the best we possibly can. So our ongoing work here in the health department includes working with our population health division to build a data dashboard for our internal use. Collaborating with them has really allowed us to better identify gaps in what we do and what we have information about, and to identify needed improvements in how we collect that data and use it within our program to better sort of aim our services at what we need to do. The primary care provider outreach work group, we're very proud of here in our program. This was requested, initiated, and led by our school health nurses. So we often allow a lot of autonomy within our program when it comes to identifying and sort of addressing needs. So this group consisted of, I believe, 3 nurses consistently. They met with all of the offices that you can see here. So this ended up being 50+ offices across Durham County, which is a pretty amazing achievement. So what they found the outcome was they really were able to share resources to each of these offices. They were able to problem solve, which is great, and address barriers in a collaborative way for both our program and these providers. We had some good changes come out of this program, or out of this work group, that we're excited to hopefully improve the way that we serve students. So we can't talk about school health without talking about what's happening in our students and their health conditions. So this gives a brief overview of the state of student health. I do want to say that the actual numbers are higher than represented here. Part of what is represented on this slide is what is documented within our electronic medical record, of which we've been transitioning to over the past 9 months. So as we continue this transition, we expect that our data is going to become more comprehensive and reliable. But from what you can see here, although these numbers may look small, there is a lot more involved in each of these numbers on this slide. And we'll talk a little bit more about that coming up in the next slides. Our goals and challenges for the year. Many of the challenges that you may see here have had really positive outcomes in increasing our collaboration with other agencies and making relationships that benefit our students. So consistency of school websites is an area that we've started to address weeks ago. We're hoping to have more consistent nurse contact information available on Durham Public School websites, and to have current forms and current COVID-19 guidance featured on both school websites and the DPS main website. We're collaborating with Durham Public Schools to ensure that all these school health resources that are available to parents are current and accurate so that parents have the information that they need. Immunization compliance efforts are an ongoing challenge. So this year, we again have planned school student days at our immunization clinic here in the health department. And this year, we've also been widely sharing information about the immunization clinic hours and services year round, because we know that we don't need to limit immunizations to any one time period. We do want parents to consider this an ongoing effort. There's ongoing work in the schools, especially to raise awareness of the requirements for students, their importance, and to reduce barriers to vaccines for families and students. We hope to improve our nurse to school ratio, and our goal is for 2 schools per nurse. There are many complex health needs among the students, as you saw on one of the previous slides. And our biggest 2 this year so far include students with diabetes and students with G-tubes. So many students with diabetes see the nurse or a school staff member multiple times per day for routine care. If the day is not routine, that number of visits increases drastically. The other health conditions represented on that slide require staff training and support throughout the year by the school nurse, sometimes intensive. And that does not consider those ongoing nursing services for students and families that we provide. And lastly,
I just have
the use
one
of
quick
our,
question.
I'm so sorry, yes.
No, I'm sorry. No, that's okay. I'm sorry. Just one quick question. We're aiming for 2 schools per nurse. What has it been in the past?
Great question. So right now, our nurse to school ratio, most of our nurses have between 2 and 5 schools.
Okay, yeah, 5 is a lot. Okay,
It
thanks.
is. It is.
Additionally, Dr. Jackson, we're proud to say that our Board of County Commissioners were leading the charge. I do believe my predecessor, Gail Harris, put that in place back in 2018, 2019. And as funds are available, they have been giving us positions.
Yeah, that's
so-
right. Okay, yeah.
Just so happened that we had this thing called COVID that kind of failed some of it, but
Right.
back to you,
Okay,
Sarah.
all right, great.
Thank you for
That's
that
good news.
question. Give you a good context. So our use of electronic medical record, as I said before, is a transition. We're in our first year of that within our school health program. This is an ongoing goal to improve quality of documentation and data. And we attend quarterly meetings with the company that owns the electronic medical record. And those meetings also include the DPS lead nurse, as well as one of our supervisors. So those meetings happen quarterly at least, but also when needed. So it gives us another opportunity to collaborate. COVID-19 updates. So we no longer have COVID-19 school-specific grant funding to provide testing in schools. So this is not occurring right now. There are tests available to families to take home and test, but we're not performing that in the school setting. We're also working to confirm DPS staff cases as a service using a shared spreadsheet, which is a system that's been in place for a while and seems to work well. Nurses are working with schools to monitor increased levels of COVID-19 cases in the schools. And COVID-19 guidance is shared from the health department to Durham Public Schools. And just recently, we've developed a meeting next week to discuss how we can put together a plan to provide a parent resource on current COVID-19 guidance. We wanted to sort of feature some of our school health staff in the past year at events around the county and team building events. So there are several pictures on this page. We were able to attend a Countdown to Kindergarten Kickoff, which is hosted by Durham Public Schools. That's in the bottom right. The 3 attendees at the School Health Advisory Committee meeting are on the top right. And on the top left is one of our school nurses attending a back to school event hosted by El Centro. And on the bottom left, we had a team building event in April, and this is the entire school health program at that moment with a couple of guest speakers, Dr. Stroman, if any of you are aware. That is the end of my presentation at this point. I'd be happy to answer any other questions.
I did have a question. And I'm sorry, tell me your name again.
My name is Sarah Snyder, and I'm one of the supervisors.
All right, Sarah, I had a question regarding the staffing. I think it was on slide 3. If we could go back to that slide, where I think it's 32 available positions, and we have 19 of those 32 that are still vacant. At what point are we at a critically low level? I would think that below 50% we're already there, but apparently not. So at what level is it critically low? And a follow-up question, if it's, are our salaries competitive to the local hospitals or the average range for nurses coming out of nursing school? I know you had the fairs at the local nursing schools to try to attract new talent. But yeah, I'm just wondering if we're competitive, and at what point do we need to maybe change our paradigm to fill some of those vacant slots?
I'd love to chime in to start with that, and Kiki would invite you to as well. I think, Chair McDougall, one thing that we are thrilled about that the board is aware has happened recently is the fact that all of our positions and pay grades associated with positions have been re-examined and adjustments have been made. So I think to your question of whether our senior public health nursing position is competitive compared to, like positions around the county, I would say that the answer at this point is yes. I think we offer a competitive salary for a public health nurse, in addition to the bonuses, the sign-on bonus and the referral bonus that you see. Certainly many of the hospital systems have perhaps touted bonuses larger than ours, but I think to the question of the salary, I do feel confident that we're offering a competitive salary. Kiki, feel free to add to that or answer Chair McDougall's first question.
Yes, one of the things I wanted to just point out with the salaries is one of the good things is that with public health are they've kind of changed, because before in school health, you could not really go out and recruit a new school health nurse or a new grad. So one of the good things about what the county is now, we're kind of revamping, because we're going along with our Dr. Susan Little. She kind of changed because of COVID. We had a lot of hard times of recruiting. So one of the good things is our experience in public health, we now get to kind of go and recruit. It used to be that you could only do for public health nurse 1, that our new grads. So that is one of the changes that we now are being able to see our new grads coming over. And this is why we're kind of doing some of our events into the schools, into the colleges. When you're asking the first question about a critical time, I will say right now, one of the things that I love about our team is that we are at a critical time, but they do it with a smile, because they know that when they go into the schools, they are making sure they're taking care of our babies, our students. And so they do it with a smile. And I will say, working with DPS, one of the things you may not know is with DPS nurses, they have 1 school versus our health department has 2 to 4 schools or 5 schools, and they do not complain about it. So when you say a critical time, because of the experience and the expertise that we are doing and redeveloping, I will say this year, even Trish gave us a really good compliment, is we have hit the ground running, and we have knocked out a lot of critical events, high acuities, and we have been really working together. So I will say what we have put it in place about kind of like what Sarah said, we're interviewing, we're getting into filling out the positions. Those are some of the tasks that I've kind of done with the supervisors, getting those positions filled, working in the communities, working in the schools, getting our faces to be known so we can really start getting really more involved. And they have hit the ground, and they are doing, I can't say enough about this team. They have hit the ground and they love what they do. So even though we may be seen as a critical time, they do it with a smile, but they do it in their nursing scope, and they do it to make sure our babies stay safe. So I hope I answered that question, but we are making sure that we are filling all of the positions quickly and much as we can, because now with the new classes comp, it really has started more of a intrigue, I would say, and with the bonus, even though it's not, but the bonus and the benefits. So I would say that is one of the things that we are now setting up for interviews, and we should be filling our positions that soon we'll be coming back and asking for some more. So thank you. I hope that answered that
Chairman
question.
Dugal, before we go to Mr. Gregorio, I just wanted to say publicly, I agree with everything that Kiki is saying. This team is phenomenal, and they certainly have hit the ground running. But more importantly, before my board and leadership team, in community at large, I said to the school health nurses that during the director of nursing interview, I let them know unequivocally that school health is the top priority. And for me personally, filling these positions is the top priority because as you know, Chair McDougall and Board of Health, we review the vacancy report often, and we see school health nurses as mainly the main one. So that is certainly top of my priority personally and professionally for this fiscal year. And I'm just delighted that we have the people in place to make it happen.
Yeah, I just wanted to say that it's clear that the nursing team is very upbeat and dedicated to their work. So much so that I was confused when I read the 19 vacancies. The presentation doesn't reflect that I'm sure they're working. I'm hesitating to say being overworked, but I know they're working hard, but the upbeat nature of the presentation wouldn't reflect any fatigue or anything like that. So I don't know the way you know, but kudos to the nursing staff. And I just wanted to make sure that this board did not need to do some things differently to try to make the funding more available so that we could recruit more talent. So thank you for your responses.
I think Mr. Gregorio had a question.
Yes, thank you so much. Ms. Snyder, thank you so much for this presentation. Fantastic job. Just wondering, what EMR vendor do you all utilize, and what does that ECAT acronym stand for?
Sure, that's a great question. And I will give you the first part, and then I'm going to ask Cheryl to tell me what the acronym stands for. So ECATS is a program. We've gone round and round over probably since 2018, looking at several school health specific vendors for electronic medical record. Part of the barrier to making a decision and choosing a vendor is that the records are student records, and so they are Durham Public Schools owned. And so what that introduces is making sure that the system is something that Durham Public Schools approves, that they can store the records there, that it's approved by them. And essentially they're allowing us to use it, which is really amazing. So ECATS is a system that's currently used in the public school system for specialized academic plans for students. And it just happens to have a component that is health related. So that is the vendor apparently that was chosen by Durham Public Schools. And so we've started that transition over the last year. As you can imagine, it is a giant hurdle to leap going from paper to EMR in any setting. But our nurses tackled it head on like they do. I mean, Chair McDougall, our nurses are a passionate bunch. Sometimes I don't know how they get the energy that they do for what we have here in front of them. But they tackled EMR the same way by creating a work group, evaluating all of the avenues, consulting and collaborating with neighboring counties on how they use it. And that sort of informed us on how to move forward. And then Cheryl, if you wouldn't mind sharing what ECAT stands for, it's escaping me right now.
Well, hi, everybody. I'm Cheryl Parsons. I am one of the other school nurse supervisors. And I have sort of led the rollout of ECATS. And I also cannot tell you what the acronym stands for. So the company is PCG Education. And it is like Sarah had said, it is a platform really for educational needs. They have rolled out some medical portions of the system, which we work with them weekly to update to have the system more compatible with the North Carolina health requirements, such as immunizations and requirements for school entry. So they've been very helpful working with us, changing some things that we need for the North Carolina state report. And this is just part of our effort to increase data collection in doing this, and they're really helpful working with us for that.
Gotcha. If I could have oh, yes, please.
Mr. Gregorio, like a good teammate, I'm going to jump in and let you know that ECAT stands for Every Child Accountability and Tracking System.
Very cool.
Now, please
Director
don't ask me who the
Jenkins.
company is.
Googled it faster than we did. Thank you for that.
I thought I
wanna-
had, but I was a little slow.
And one of the, I wanted to just mention also with the ECATs is that some of the challenges that we did come up was gathering our data back for our state reporting. And I wanted to say again, for the school health, they work with population health. And so we actually got our own dashboard that we can pull in data to be able to making sure that we are looking at our data, making sure that we're looking to make sure we can put it to the state, because the state is also now working on opening up a modules in Power School that would allow us to kind of transition from this medical record system to what they are working on. So hopefully that will be rolling out soon, because they found a lot of the time with this particular system, we can't adapt the data. So I want to say kudos to our population health, because they kind of jumped in and they was like, okay, tell me what you need. And they really helped our school health to be able to meet because we have, once we collect all the data, we have to report it at the end. So that is one of the things that even internally working. So it is really good working with our internal population health.
Great. Thank you all. And if I could have a follow-up question, how do we compare to other states in terms of, digital transformation, incorporating an EMR with our school systems?
I would have to speak anecdotally. It seems like in the school nursing world, more people use EMR than not. And so I think that we were maybe a bit behind that transition time-wise. Even the reflection on working on this transition for the past 5 to 6 years is sort of a reflection of that. But I'm glad that we're here now.
Gotcha. Thank you so much.
Absolutely.
Looks like Dr. Braithwaite has a question. Go ahead, Dr. Braithwaite.
Yes, thank you, Sarah. Thank you, Kiki, for these responses, and the presentation as well, Sarah. One of the questions I have is related to vaccinations. I'd like to know if you guys have an idea of how our vaccination rates in Durham County compare to other school systems, and if there is a way of being able to track individual students and target them to get their vaccines. And the reason I ask is, as a pediatrician at Chapel Hill Peds, periodically we get kids coming in because they've gotten reminders from Orange County or Chatham County schools that they are due for a Tdap or meningitis vaccine. And sometimes that can be very helpful as a trigger or reminder to a parent. Some of those students have already had those vaccines and they just needed a printout of their record. But I'm just curious as to how Durham County is handling that.
I will say, do you want to answer? Y'all can jump in and I'll jump behind you.
I can't answer how we compare. Oh, go ahead, Cheryl.
I can just speak a little on the procedure. We do a very similar procedure in Durham County with our schools. We get a list of kids missing immunizations from our data managers. Our nurses go ahead and look them up in NCIR and then go ahead and send out that reminder letter. And after the first reminder letter, if they don't get anything back, they do follow-up phone calls until they can get the vaccines. And if they're not linked up with a primary care physician, there's also that referral piece to the health department. And I was at one of my schools today and checked in about that. She said out of all of the 7th graders, she only had 2 left that were non-compliant. So those efforts are working.
I do want to jump in. One of the main things that I work with Ms. Trish Howard at the DPS is for vaccines, because historically we've had very low rates of our vaccines, making sure that we're in compliance. And so that was one of the things that me and Ms. Howard really worked on. And so we've been working together, making sure. So I know more to come, because it's not the full 30 days to be able to be the final letter. I always like to say the final letter to the parents. But one of the things that we really worked on is looking through those records where before it was not with the nurses. So it really was more so of data managers, and they still work really closely, but they really are working really closely with our nurses this year. So those are some of the things, kind of like what Cheryl said about they only had one. So we're seeing our rates kind of coming down, because this is something that we really wanted to work this year about looking through our information and meeting those needs. And so we'll have more to come about if we have to go and do vaccinations, or how do we open up our clinics more. So those are some of the things that we're waiting for to see, because of, again, with the vaccine clinic, we can open it up to them for them to make sure that they have the availability to come. I hope that answered your question.
Dr. Braithwaite, I was just going to follow up to say that I know that the challenges that we have in Durham County certainly are being felt across the state. I don't think we have those numbers right now to your question of how Durham compares to other counties, right off the top of our heads, but that is information that we'd happily be able to gather and share with the board. Because we're coming out of COVID in particular, we know that this is top of mind statewide.
I did want to add, this is not something that I included in our presentation today, but over the past school year, we also had an immunization work group, again, led by our nurses. And one of the things that they were able to do that I feel was very successful was partner with Lincoln Health Center. And one of the things that they got discussing about, particularly 7th grade immunizations, was how we can sort of break down that barrier, raise awareness, and get students in. And so Lincoln sort of took it and ran with it. They were able to develop a time, several dates between which they grabbed all of those patients in their patient population and had a team to address each of those students and what their needs were and get them in within a certain span of time. And so because we know a lot of those patients are in our schools, that was sort of a way where we could address it from that side instead of finding that gap that needs to be addressed and then addressing it in that first month of school. So really being proactive and making sure that those kids not only get their immunizations, but they've got that connection with their provider and it's ongoing.
Thank you. That was very helpful. And thanks also to you, Liz.
Yeah, happy to.
All right. Do we have any other questions? All right. Well, I want to thank Kiki, Sarah, Liz, Cheryl, and I hope I'm not forgetting anybody else, but the entire school health team. I want to echo Director Jenkins' sentiment in saying, be of good courage. Support is on the way. So we look forward to adding to your team so that you're able to do your job even better than you're doing it right now. So thank you again for your hard work and dedication.
Thank you for having us.
Absolutely. So we're going to move on to our next presentation with Corey Morris and the lead testing update.
All right. Good afternoon, everybody. If anybody can, oh no.
We can hear you.
Well, I got a message saying Zoom had quit unexpectedly, and apparently Zoom did not quit. So that's a good thing. All right, everybody. I'm Corey Morris. I'm the Public Health Preparedness Coordinator for Durham County Department of Public Health. Much appreciation for having me here this afternoon. I just want to talk real quickly about the elevated lead concerns that are going on in the soils at Durham City Parks and our public health response to those concerns. So first, just a little background. From mid-2021 to late 2022, a Duke graduate student, Iniko Bahari, collected soil samples at 3 Durham County parks that had previously housed waste incinerators. And those parks were Walltown Park, East End, and East Durham Park. Incinerator sites are a concern because of the ash that results from incinerating municipal waste is often high in heavy metals, including lead. The EPA defines a soil lead hazard as bare soil on residential property or on the property of a child-occupied facility and contains lead in total of in excess of 400 parts per million in play areas, or averages more than 1,200 parts per million in bare soil areas that are not play areas. Excuse me. So Bahari found that each of these three parks had at least one sample that exceeded 1,200 parts per million. Again, that's the limit for non-play areas. However, it's not specified in Bahari's research that all of these samples came from bare soil, which is an important consideration when we're talking about a route of exposure to lead in the soil. So after learning these results, the city of Durham contracted Mid-Atlantic Associates, a Raleigh-based engineering and environmental consulting firm. The city requested sampling at the following parks, which is beyond the ones originally sampled by Bahari. Those parks were Walltown, East End, East Durham, Lyon, and Northgate. Mid-Atlantic developed a work plan for sampling these parks, and that work plan was subsequently approved by the North Carolina Division of Environmental Quality. The focus of this investigation was the rapid assessment of lead contents of the soils in these parks. Sampling took place on July 19th to July 26th of this year, and the consultants collected more than 400 samples in total from these parks. The results from Mid-Atlantic samplings were released in mid-August. Mid-Atlantic found that each park had at least one sample that exceeded 1,200 parts per million in the non-play areas.
Corey, can I interrupt you?
Yep, absolutely. I'm hoping that you're telling me that my slides are not advancing.
They're not advancing.
They're not advancing.
They're advancing on my end. Are you guys still at the title slide?
We're at the very first.
Yes, sir.
All right. Pardon me. Let me close Zoom. My apologies. I'll be right back.
Okay. I would sing for you folks, but I don't want you to throw virtual tomatoes at me. So
All right, Marcia, let's see if you can make me host again. Yeah, thank you. Okay, everyone should be seeing a slide with a map on the right-hand side. If anyone can. Excellent. Thank you, Chair McDougall. All right, we'll start at the beginning of this slide. My apologies for the issues. So anyway, the results were released in mid-August from the sampling done by Mid-Atlantic. They found that each park had at least one sample that exceeded the 1,200 part per million non-play area limit. However, none of the parks had samples that exceeded 400 parts per million in the playground areas. It's worth noting that in Walltown, East Durham, and East End parks, these parks all had playground areas with fabric liners. So these liners isolate the soil under the playground mulch from the ground surface, particularly in the areas where there's playground equipment, and that makes that soil inaccessible. So areas with fabric liners were not sampled because the soil is inaccessible to children using the playground. In any case, Mid-Atlantic concluded that there were no exposure risks at Northgate and Lyon parks and no impacts in the accessible areas of East End Park. They recommended that access to the areas of Walltown Park and East Durham Park be restricted where the lead levels were above 1,200 parts per million. On the positive side, neither Walltown nor East Durham parks had samples above the playground area limit within 60 feet of a play area. In response to the community interest in the impacts of lead that was found in the parks, our department activated our incident management team on August the 11th. Also on that day, we began investigating the logistics of mass lead testing at the department. After working through our operational, financial, and logistical questions for this operation, we announced on August the 25th that we'd be open for testing the following week. That happened on August 31st when we began offering testing for children under 7 years old and over 6 months and pregnant women. In addition to testing, we offer, as always, educational resources in our clinic. And we're using the North Carolina State Laboratory for Public Health to do our sample analysis, and we're communicating the results that we receive and next steps to clients. So these efforts are being funded by the North Carolina Agreement Addendum 543, which is enhancing laboratory capacity funding. The primary cost and logistical concern has been contract phlebotomists, which we source from quality staffing. Otherwise, it was just a matter of procuring the space and the general supplies for testing. From a process and planning standpoint, my main responsibility is simply keeping the objective-driven planning process moving, and then realizing that we will eventually demobilize and planning for that. So as with any incident response, public information sharing has been critical. Information sharing for this event has been a two-pronged approach, very similar to how we did COVID. Lindsay Bickersbach, Dennis Hamlet, Lakita Sanders, and the rest of the Help Ed team have been focusing on up-close communication with our partners and our clients, while Dr. Alicia Smith, our PIO, has been keeping up with public information officer responsibilities, including news releases, interviews, publicizing the clinic on social media, our website, and then broadly communicating with the staff to keep them informed of what's going on in the building. So that's where we're at right now, in a nutshell, our lead experience. Happy to answer any questions that anyone. Yeah, go ahead, Mr. Brown.
Hey, thank you. So how has testing utilization been over the last 2 weeks? Like, how many pregnant women or children have actually come into the clinic for that blood-based testing?
Rod, happy to let you speak to that, or Liz, or I can handle that. Just whoever wants to chime in.
More than happy to. And it's a dismal amount, Mr. Brown and other members of the board, but we are committed to doing the right thing for the community. But it pains me to say that only 2 people have come in to the clinic. And the second person coming in today.
Thank you.
All right, let me get my list back up, and I will gladly take, I believe it was Commissioner Alum that had the next question.
Yeah, thank you, Corey, for this presentation and this research. I just wanted to confirm, I saw an article recently, I think it was WRAL. So I know that it's, we're obviously not very concerned about the lead being tested in our parks, but haven't they also been finding that this isn't something that's just happening in Durham? That they, like the Duke researchers who've been testing the Durham parks, have also been discovering it outside, and that it's not necessarily just a Durham specific issue?
So I'm happy to speak to that, or Chris, if you'd like to, it's up to you. All right, in that case, so I imagine that you and I probably read, if not the same articles, then similar articles. And so it's my impression that what started this concern was the presence of municipal incinerators in Durham. According to what I read, those municipal incinerators were deactivated in the 50s. But I think that there are certainly other cities that are in a similar situation. So yeah, I don't think this is a unique to Durham problem.
Yeah, Corey, I'm sorry, this is Chris. I was having trouble getting unmuted. That is something Rod can attest to this as well. We pulled state epi in very early in this process when the city reached out to us. And I believe that it only makes sense to think that Durham would not be unique in the fact that, incinerators were used back in the early 20th century all the way up to the 1950s. And I doubt it was uncommon that other cities and towns transformed those sites into parks. So it would only make sense that the state had some concern that this could be an issue statewide. I have not heard anything from anybody at the state level that they have discovered any serious issues anywhere else either, though.
Thank you, I appreciate it. Yeah, I mostly just asked because obviously, again, we're concerned about it, but also to be able to provide that information to residents, I think is also important for them to know this isn't an issue that Durham created. this is something that, past policy decisions caused, but our current Board of Health and our health director and our city and county is working to resolve it as soon as possible.
Yeah, and one more thing that I would like to add to this is that we went out, myself actually, and Laura Lurch and Chelsea Wooten, our lead program specialist, we went out with one of the industrial hygienists from State Epi, and we surveyed the 3 original parks that were implicated. And we concluded that there's really no route of ingestion because everything's grassed over very well. There's a foot to 2 feet of mulch on the playground areas, like Corey said, and there's no bare dirt anywhere. We had some concerns with one of the parks that possibly it was being used, portions were being used as a parking lot. And on the overhead maps, it looks like it may be bare dirt, but everything is very well grassed over. So you would have to let a small child, sit there and just dig down through the grass and ingest the soil in order to become poisoned or get an elevated level. So we feel good about that aspect of it anyway.
And Mr. Chair, before we cede the floor to you, I just want this board to know, contrary to what was said and what has been published by certain individuals, this public health department found out about the Duke report at the same time that the Walltown Association sent the email out to the general public. And upon finding that out, we immediately took action, got involved with the state, got our local officials involved, and we have been involved ever since. So I would venture to say that our response has been nothing short than most proactive. We didn't sit around. The only time that we really had to sit around is to wait on the actual report. But even doing that, we still engaged the state, from State Epi to the chief state epidemiologist, Dr. Zach Moore, all of which have been detailed a number of times with the correspondence between yourselves as a board and the Board of County Commissioners. Back to you, Mr. Chair.
Thank you. Thank you. I did have a question, and I think through the conversations and the presentation of Corey's and the input from Chris as well, I think my question is answered, but I want to ask it anyway, just for clarification. I know, and I want to thank Corey for the presentation, particularly for being specific about where the different areas, the play areas versus the, the surface soils, and the different levels required, or the different level criteria for the different areas. So no excessively high levels or anything above 400 parts per million in the play areas in any of the parks, right? No samples.
That was my reading of the Mid-Atlantic report, correct?
And then with the was it Walltown and East Durham parks? I think there were some samples over 1,200 parts per million in surface soils, again, where children are not, I guess, accessing those areas. But is there a plan to clean up those areas where there were samples that had more than 1,200 parts per million of lead?
Corey, I'll go ahead
sir.
And kind of talk and welcome Chris Alter to jump in. But again, that walkthrough that Chris and team and the state team did was very, very effective because it allowed them to see where it was, based upon the initial study. We have engaged the state at every level. The next level is really having conversations with a gentleman who is sort of like the liaison between the EPA. And as we mentioned, he indicated that he didn't really see where there is imminent danger, so to speak. However, my premise, one or two things has to happen. I can really engage him as public health director, which I have, or the city can specifically request that, remediation begins. And again, the operative word here for my board is proactive, and we've done that. I just had a conversation a couple of days ago with the state and asked, have you had that conversation with this representative, to which they said yes. And they don't really feel as if it's risen to the level to get the EPA involved, so to speak. However, even with that, Chair McDougal and Board of Health, it is still the prerogative of the EPA if they want to get involved. But rest assured, from a local level in Durham Public Health, we have done everything that we're supposed to do in order to address the issue. The only two things that have come up most recently is, do we expand the age, and do we do mobile testing? And the unfortunate thing is we're not necessarily privy or prepared based upon what we've seen to do both. Number one, we don't have the bandwidth or the finances to do mobile testing going everywhere, primarily because we have a clinic that's been open for 3 weeks now, and we've only had 2 people, and it's been broadcast wild. And then, of course, changing the age, we have the capacity, but in talking to the state, they're of the opinion that you need to stick with 6 months to 6 years, 6 years old, because that is the CDC's recommendation, primarily because of kids and their level of development and their propensity to probably play in dirt and possibly ingest dirt. So with that question, I hope I answered it, but I'm just saying we have done everything that we're supposed to do in order to ensure that action can be taken. The proper authorities know, and just kind of letting them know that, we've done all that we're supposed to do, and we await further instructions.
That does answer my question. Thank you. Do we have any other questions regarding our lead testing update? All right, well, thank you again, Corey and Chris and Director Jenkins, for your input in this conversation. So we'll move on to our next item on the agenda, which is our public health vacancy report. We've talked about that a little bit with the school nursing, but I'll give the floor to Director Jenkins to talk about it if you'd like. It looks pretty static, but yeah, maybe a little improved from last month.
I promise to be really brief. We're starting off. The one thing I will say, it can be a little deceiving, primarily because, so far for this fiscal year, we're at 9, but out of the 9, 5 were either a new position. And what I'm most proud of to this Board of Health is 4 were actually promotions. And I'm definitely a proponent of promoting from within, those people who know the organizational culture, understand how things work. But for the most part, when they do get promoted, it does create a vacancy that we have to fill. But that's the only thing about the vacancy report that I wanted to touch on, Chair McDougal.
Thank you. Okay, so the next presentation or report that we need to look at or discuss is our public health NOV report. I don't remember seeing Patrick Eaton on the call. But again,
I know Chris Salter is familiar with the report, but I'll cede the floor to Chris.
Yeah, Patrick's not here. There's been actually the biggest thing for this report is that Patrick and I met with Al Andrews just a week or so ago and spent a few hours with him, bringing him up to speed and providing an explanation as to the rules for on-site wastewater are very complex, and what you can and can't do legally, and what's really an issue and what's really not such an important or as important issue that may show up here, like lack of an operator and things like that. We try to explain, and Al's done a great job. I mean, he's very receptive to learning about this stuff, and you know, I'm sure that eventually he'll be a good asset to us in seeking injunctive relief when we need to, and working with us to try to, you know, find solutions to get people off of this list. Obviously, we're not out here trying to place a burden on anybody to correct these problems, but you know, that's what we're tasked with, is getting people off of this list. That's the point of the list, is to identify the problems and fix things. So we haven't made any great strides on here, but we are still monitoring. There's been, I think there were a couple, if I remember correctly, I think there were a couple that came off. Looks like 8307 North Roxborough was finally taken off the list, and 2330 Thunder Road. I don't know what to say unless there are some specific questions about the report, though.
I don't have any specific questions, no.
Okay.
Thank you. Thank you for that information, though. Does anyone else have any questions about the NOV report? Okay, well, we're going to move on to the Health Director's report. And Director Jenkins, you have the floor.
I'll be brief. I just, want to continue to lift up all of our departments, but bring specific attention to what was going on with in the month of June. I think some members of the board heard about it, but there was a National Gun Violence Awareness Month in the month of June. I finally made your report, but our Firearm Injury Prevention Partnership, formerly known as our gun safety team, was heavily involved. And I just want to really lift up our relationship and our special collaboration, not only with the Sheriff's Department, as seen with most recently in the news with us setting up a naloxone vending machine at the detention center, but also with the District Attorney's Office. There was a very special presentation that I was able to do, a press conference with District Attorney DeBerry, and we were able to set up shop and give gun locks and pass out a lot of good information about firearms awareness outside the courthouse. So that's pretty much the only thing from the Health Department, Health Director's report that I wanted to lift up, Mr. Chair. Once again, a lot of great work. Definitely would love to highlight everything, but our Cosby's on his way. And I'll just continue to say that this also dovetails nicely. In a couple of weeks, we will have a firearms prevention pre-conference to the North Carolina Public Health Association. I was heavily involved. Durham continues to lead the way with that. And it's going to be several hundred people coming from all around the state and the country to really talk more about firearms safety.
Very good. I did have one question, Director Jenkins.
Yes, sir.
In regards to the dental division, the partnership with Adams School of Dentistry Pediatric Department, when the residents and students and faculty are they coming in from UNC, or are they seeing the Durham Department of Health patients at UNC, or are they seeing them in Durham?
They come into our agency, and we've been welcoming them with this unique partnership for over 12 years. And it certainly works. It's not without its challenges as depicted inside the document, from a electronic health record, HIPAA, getting them onboarded. That can be a little streamlined. I'm proud to say that we have a very robust onboarding project, not just for our residents and our contractors, but for full-time employees as well. But other than that, we've been able to provide care to many, many kids in Durham. So I'm definitely thrilled that partnership continues to grow strong.
Awesome. Thank you. Okay, well, I think we are moving on. I don't see anybody else's hand up for questions. So we're gonna speed on through the agenda. We don't have any committee reports, no old business. So the new business that we have are the budget amendments. And Ms. Richardson, let me know, Dr. Braithwaite had to drop off, so we might not have quorum anymore. So I don't know if we can.
I think we do. Rosalind, is that correct?
1, 2, 3. 4. I don't see a quorum. 1, 2, 3, 4, 5. I think we need 6. I think you have 10 board members, so a quorum would be 6, correct, Attorney McKinney?
Yes, that's correct. I don't have
Yes,
these bylaws in front of me, but you do need more than
yes, sir.
50.
Yes, sir. So we can't approve these.
So I guess do we need to call a special meeting?
Well, what we can do,
Next.
Chair, is I can send them to you and Dr. Ray, and
Yes,
let's do a budget ratification next month
okay,
so they can move forward.
okay, we'll do that,
Correct, Attorney McKinney?
Yes, that's correct.
All right, I apologize about that, but I know we had a lot of absences today due to travel and other issues, so. But I did want to congratulate Director Jenkins and his staff because with these amendments, I counted over 2.7, almost $2.7 million in funds coming into the department as a result of these acquisitions of funds. So congratulations and please
Thank you,
continue.
sir. We
Yes, sir.
appreciate it.
Okay, yeah, so we'll get that information from you, Roz, and we'll do the ratification at the next meeting.
Yes, sir.
So for the do we have any informal discussion? Anybody have anything they want to share? All right, we'll move on to the agenda items, or I'm sorry, we'll move on to the agenda items for next month. And we do need to review and approve the updated Board of Health Operating Procedures Manual. I know we had a meeting last week on that, so we should be ready to present that at the next meeting, along with a presentation on the annual youth risk-based survey. I think that presentation is being prepared as well for the October meeting. Is there
Yes, sir.
anything else that we need to include?
No, sir, that'll be it.
All right. Well, if there's, again, no informal discussion, I will entertain a motion to adjourn.
Excuse me, Attorney McKinney, how do we do this? We still don't have a quorum.
True.
Do we just say
Does that
bye-bye?
mean we have to stay all night?
No,
Next
do we
meeting.
just say,
It's an indefinite board meeting. Hang on just a second. If you can indulge me for a minute, I'm going to see what I can find out about,
Robert's rules.
see what Robert says and see what our bylaws say.
okay.
Maybe some sort of recess.
Suspend the proceedings until.
Can the chair and vice chair do it?
Yes, you can absolutely suspend a meeting for sure. That does not require a majority vote. That can be done by the chairperson, by the person in charge of the meeting.
All right, so let's do that. We'll suspend the rest of the proceedings, the budget amendments, and even the adjournment until the next meeting.
That's right. And if whoever's keeping the minutes, of course, you'll take note of this so that you can end this meeting next time there's a quorum and proceed from there.
Yes, sir.
All right, well, proceedings are suspended until the next meeting. I appreciate everyone for coming and attending. We had a quorum for a while, for about 40 minutes, but we'll do better next time. Thank you again, everyone, and be safe until next month.
Thank
Thank you,
you.
everyone.
Thank you.